Ever wondered what's the mystery behind those excruciating kidney stones, or the reason behind frequent urinary tract infections? Is it about diet, genetics, or something more? Curious about nephritis and renal failure? Stay tuned as we dive deep into the world of the urinary system and its common diseases. Imagine a small, hard deposit that forms in your kidneys. That's what we call urinary calculi, more commonly known as kidney stones. These pesky pebbles are not exactly a picnic. They form when your urine contains more crystal-forming substances such as calcium, oxalate, and uric acid than the fluid in your urine can dilute. But how does this imbalance occur? Well, there's not a one-size-fits-all answer. Factors range from medical conditions like renal tubular acidosis to something as simple as not drinking enough water. Even certain diets can increase your risk. Consuming too much protein, sugar, sodium, or vitamin D can tip the scales in favor of stone formation. Now let's talk symptoms. If you've ever heard tales of kidney stones, you know they're notorious for being painful, and for good reason. When a kidney stone moves into your urinary tract, it can cause a lot of discomfort. Symptoms might include severe pain below the ribs, back and sides, pain during urination, and even pink, red, or brown urine. Other signs can be nausea, vomiting, and frequent urination. But remember, these symptoms can vary depending on the size and location of the kidney stone. Not all kidney stones are created equal, though. They can range in size from as small as a grain of sand to as large as a pearl, or even larger. But don't worry, most kidney stones are treatable, and many can even pass through your urinary system on their own. However, if you're experiencing severe pain, have a history of kidney stones, or suspect you might have one, it's always best to seek medical advice. After all, health is wealth, and our kidneys are priceless. So, next time you feel a sharp pain in your lower back, it might be a kidney stone. Remember, it's not just about knowing what's going on inside our bodies, but also understanding how to take care of them. After all, our bodies are the most intricate machines, and maintaining them well is the key to a healthy and happy life. Now let's talk about a condition that involves inflammation of the kidneys, known as nephritis. Nephritis, in its simplest terms, is an inflammatory disease of the kidneys. It's like the body's waste management system deciding to go on strike, causing a pile-up of waste products that should have been neatly disposed of. This can lead to a host of problems, ranging from mild discomfort to severe health risks. What causes nephritis? Well, it's often the result of an autoimmune disorder, where the body's immune system mistakenly attacks its own cells. This can be due to diseases like lupus or vasculitis. It can also be triggered by infections, certain medications, or toxins that damage the kidneys. However, nephritis isn't like a common cold that you can spot right away. Its symptoms can be subtle and may take time to become noticeable. Some of the common symptoms include changes in urine color, often becoming darker, and an increase in frequency or urgency to urinate. You might also notice swelling in your body, particularly in your face, hands, and feet, as the kidneys struggle to remove excess fluids. Other symptoms can include fatigue, high blood pressure, or even weight gain due to fluid retention. But remember, these symptoms can also be associated with other conditions, so don't jump to conclusions on your own. Always seek medical advice if you're experiencing these symptoms. So, how is nephritis diagnosed? Well, doctors usually employ a range of tests, including urine tests, blood tests, and in some cases, kidney biopsies. These tests help determine the presence of inflammation, the function of your kidney, and identify the possible cause of the inflammation. And what about treatment? The treatment for nephritis largely depends on the cause. If it's due to an autoimmune disease, doctors usually prescribe medications to suppress the immune system. If it's caused by an infection, antibiotics may be used. In severe cases, dialysis or even kidney transplant may be necessary. Remember, early detection is key when it comes to nephritis. Staying informed and understanding your body can make all the difference in managing this condition. So don't ignore those subtle signs your body may be giving you. Ever felt a burning sensation while urinating? You might have experienced a urinary tract infection. A urinary tract infection, or UTI, is an infection that affects any part of your urinary system, which includes your kidneys, bladder, ureters, and urethra. Most UTIs are caused by bacteria, but they can also be caused by viruses and fungi. Now, let's break down the causes. You see, our urinary system is designed to keep out such microscopic invaders. However, sometimes these defenses fail, and bacteria, viruses, or fungi manage to take hold and multiply within the urinary tract, causing an infection. Women are particularly at risk of developing UTIs due to their anatomy. In women, the urethra is shorter, which shortens the distance that bacteria must travel to reach the bladder. However, men can also develop UTIs, especially those with an enlarged prostate, as this can slow the flow of urine and give bacteria more time to grow. So, what does a UTI feel like? Well, the symptoms can include a persistent urge to urinate, a burning sensation during urination, passing frequent but small amounts of urine, cloudy urine, strong-smelling urine, and pelvic pain in women. It's important to note that these symptoms can be caused by other conditions as well, so experiencing them doesn't automatically mean you have a UTI. However, if you do experience any of these symptoms, it's crucial to get checked out by a healthcare provider. UTIs are typically treated with antibiotics to kill the bacteria causing the infection. Drinking plenty of water can also help dilute your urine and ensure that you urinate more frequently, flushing bacteria out of your urinary system. Remember, UTIs can be serious if they aren't treated promptly. If left untreated, the infection can spread to your kidneys, leading to kidney damage or even a life-threatening condition called sepsis. Urinary tract infections are common, but can be extremely uncomfortable, so make sure to seek medical help if you suspect one. Last but not least, we delve into the world of renal failure, a serious condition where the kidneys stop working effectively. Renal failure is a medical condition that occurs when the kidneys cease to function properly. These vital organs are responsible for purifying our blood by removing waste and excess fluids. When they fail, it means they're not able to do their job, and that can have serious health implications. But what exactly causes the kidneys to fail? There are numerous triggers, but the most common include long-term conditions such as diabetes and high blood pressure. These conditions can damage the kidneys over time, reducing their ability to function. Acute kidney injuries, resulting from incidents such as severe infections, certain medications, and trauma, can also lead to renal failure. Now, how would you know if you're experiencing renal failure? The symptoms aren't always apparent at first and can be mistaken for other conditions. They include fatigue, decreased urine output, swollen ankles and feet, persistent nausea, and shortness of breath, among others. These symptoms arise from the buildup of waste products and fluids in the body that the kidneys should normally eliminate. It's important to note that renal failure isn't just a one-step process. It often progresses in stages from mild to severe. This progression is categorized into acute kidney injury, chronic kidney disease, and end-stage renal disease. Acute kidney injury is a sudden episode of kidney failure or kidney damage that happens within a few hours or a few days. Chronic kidney disease, on the other hand, is a long-term condition where the kidney's function gradually declines over time. End-stage renal disease is the final stage of chronic kidney disease, where the kidneys have lost almost all their function. Renal failure is a serious health concern that requires immediate medical attention. If you or anyone you know experiences any of these symptoms, it's crucial to seek help from a healthcare professional. Remember, early detection and treatment can slow down or prevent the progression of kidney disease, potentially saving a life. Renal failure is a serious condition that requires immediate medical attention, so always listen to your body. We've covered a lot today, from kidney stones to renal failure. So let's take a moment to recap all the key points we've discussed. We started with urinary calculi, also known as kidney stones. These hard deposits made of minerals and salts form inside your kidneys, causing severe pain and discomfort. They can form when the concentration of certain substances in your urine increases, and they're more likely to develop if you don't drink enough fluids. Next, we delved into nephritis, an inflammation of the kidneys that can lead to kidney damage or even kidney failure if not treated promptly. Symptoms can range from blood in the urine to swelling in your hands and feet, and it's usually caused by an autoimmune disease or an infection. Moving on, we took a deep dive into urinary tract infections, or UTIs. These occur when bacteria enter the urinary tract, leading to infections that can affect different parts of the urinary system. UTIs can cause a range of symptoms, from a burning sensation during urination to lower abdominal pain. Finally, we discussed renal failure, a serious condition where the kidneys lose their ability to filter waste from the blood. This can lead to a buildup of waste products and fluid in the body, affecting other organs and potentially leading to life-threatening complications. Each of these conditions affects the urinary system in different ways, but they all underline the importance of maintaining good hydration and overall health. Remember, your body is a well-oiled machine, and every part plays a crucial role. And that's a wrap. Subscribe for more because you won't find me later. Until next time, keep exploring and stay curious.